There we go.
I understand that the following information will be gathered and utilized for educational purposes by an Indiana Wesleyan University student. I give my permission for this information gathering and physical assessment to be filmed and posted for access by faculty and students at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only, and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the student, are not considered liable. So, my test patient is Miss Carmack. She is a 50-year-old white female brought to the emergency room by her husband for complaints of nausea and vomiting. She was recently diagnosed with breast cancer and has begun chemotherapy. Miss Carmack.
Hello, how you doing?
My name's Jody. I'm going to be your nurse today. I'm just going to ask you a few questions and check you over a little bit. Oh my goodness.
Excuse me.
Can I get you some ice chips?
Yeah, I got some here.
Okay. So, I just got a few questions for you. So you feel like this nausea and vomiting started after your last round of chemo?
Yes, it has. It seems like I've tried some medicine I got at home and it's not working.
Okay. So what did you take at home?
Some Zofran and some Phenergan.
Okay. Do you have any idea on the dose of those?
The Zofran was 4 milligrams and the Phenergan 25.
Okay. So you didn't get any relief from either of those, you don't think?
Not like I usually do. It just seems like it's been worse.
Okay. Are you having any pain?
I've had pain in my breast where they did a mastectomy on me. It's been really sore.
Now, how long ago has that been?
It's been about 3 months ago.
Okay. Now, did you have to have a port or anything put in for your chemotherapy?
Yeah, they put one of the power ports up here on my...
Okay. I'll probably look at that dressing when I do your assessment. Have you had any ill contacts, been around anybody with this type of symptoms?
No, I haven't been. I think it's just related to that chemo. They did one stronger this time.
Okay. So, are your immunizations up to date as far as you know?
Yeah.
You had a flu shot?
I had a flu shot about 2 months ago.
Okay. Do you take the pneummonia shot?
No, I haven't taken it yet.
The shingles vaccine?
No.
Okay.
I'm afraid to right now with my immunization being low.
Sure. Do you have a religious preference?
I go to Kentontown Christian Church. Okay. Christianity.
Now, if for some reason we were to admit you to the hospital, would you want your minister to visit you while you're here?
Yeah. Brother Ed Applegate's his name. He knows I've been sick and he's been visiting me at home.
Okay. So I'm just going to ask you a few questions about your living situation at home. We ask the same questions of everybody that comes in. Do you have any running water in your house?
Yes.
Do you have to climb steps in your house?
Got to go down the basement to do my laundry, but other than that, no.
Okay.
My husband's been helping me with that.
Okay, very good. So, your husband brought you in today, is that correct?
Yeah. He's been very supportive.
Great. Now, do you work outside the home?
Yes, I'm a nurse.
Okay. So, are you trying to work through this illness? Are you taking some time off?
I've taken some time off, but I've been trying to work in between times so I don't use all my medical leave.
I understand. Do you have any food preferences?
The foods that's been tasting the best to me is just cold foods like Jell-O, ice cream, Sprite. Because my mouth's kind of I don't have much of a taste anymore.
I understand. Do you have any other health problems other than the breast cancer and receiving chemo?
No, the only thing is I'm on the borderline with my blood pressure. And when I get under stress, it seems like it bothers me quite a bit more.
Okay. Have you noticed any dizziness since you've started all this nausea and vomiting?
I felt awful weak, and when I get up and down from the bed, I get really dizzy-headed. Okay. So I've got to be careful not to fall, because I've been...
Sure. Mm-hmm. And your pain?
I've been rating my pain about a 4.
Okay.
Where I've had that recent surgery. It's been really tender.
And you said, did you say you took Lortab for your pain?
Yeah. Take Lortab. I take maybe 1 or 2 a day. I try not to take very many.
I understand. Do you have any financial concerns?
I'm worried if I have to miss too much work, I might end up losing my job. They've been really good so far, but I'm concerned about that.
Okay, so I'm going to check you over a little bit.
Do I need to turn on my bike?
Please.
Okay.
And listen to your belly. And let me know if I'm causing any pain by what I'm doing here, okay? Looks like you got a little hernia there.
Yeah, it didn't bother me, so I hadn't done anything about it yet.
How long has that been there?
Oh, probably 4 or 5 years, maybe more. Okay. All that lifting we have to do.
Sure. And when did you say the last time your bowels moved was?
I've had some diarrhea, so they've been moving every single day, sometimes 2 and 3 times. So.
Okay. And you said you did have a port?
Yeah.
Do you mind if I look at that dressing?
Yeah.
Okay. Now, how often does that dressing get changed?
Once a week.
Once a week. And you do that yourself, or you have somebody do it for you?
Yeah, I can do it.
Okay.
They flush it for me, but I do change my dressing.
Okay. All right. Very good. Well, we're going to have the doctor come in and check you out and see if we can get you feeling better.
I appreciate that.
Is there anything I can get for you before I leave the room?
Yeah, could you give me some ice chips?
I sure can.
Okay.
I'll be right back.
Bye-bye.